Welcome to this channel. If you're new here, my name is Bianca Chenai, and on this channel we talk about educational stuff. We talk about women's health, neurodiversity, and we also take a dive into the showbiz. So if you're new here, welcome, and please guys share and recommend this channel. And today we are going to talk about something that is closer to home, something that I've had to deal with over the past couple of years, or it's not even couple, over the past years. And today we're going to talk about PCOS, which is polycystic ovarian syndrome. And I'm your host, Bianca Chenai. So just to put a disclaimer out there that I am not a healthcare professional, and I'm not a qualified psychologist or anything like that. Though I'm a qualified educational psychologist. Sorry, let me rephrase that. I'm not a psychologist in telling you what is going on your body, in your mind. No. I'm an educational psychologist where I talk about kids who are dealing with neurodivergence. Anyway, without wasting much of your time, we are going to be talking about PCOS, polycystic ovarian syndrome, which is one of the biggest factors that is causing infertility across the globe. We have got a surge in the number of cases of women who are failing to get pregnant. So this is just an informative channel. If you don't know what is going. Okay, so as we say that polycystic ovarian syndrome, according to what I was told by my gynae, is mainly a hormonal disease. So it means inside you there are hormones that are much more, or there are hormones that are much less than the ones that you require. So personally, my journey started when I was 8 years old. That is your child who is in grade 2, because now kids are going at 7. So that is your child who's in grade 2, and they are playing on the Junglegym, and then suddenly their life stops and is interrupted. They come to you and tell you that I'm bleeding, because they don't understand what is going on. So you realize that they have actually started their menses, and when one starts their menses, it means that they are actually now fertile. So there is a possibility that if someone plays with your grade 2, they might actually fall pregnant. That is not something that I wish upon anyone, especially the parents, because as a mother, your first instinct is to like, what am I going to do? It's panic mode. So when I started, we didn't have much info at hand of what was going on, just like we do now, because now we know that, there is a problem with the hormones. Because when I started my period during my primary years, I would see, and I used to go for 5 days, and during so throughout my primary years, my period was a consistent 5 days. I would see my period every month. But then when I started high school now, my period kind of like stopped. So especially some terms, I would go the whole term without seeing my menses, and I was in a boarding school. I would not see my menses, and then maybe the other term it will come once. So I think at the end of my secondary years, around form 5, form 6, I remember consulting a GP, and they said no, it's normal. We'll only start getting worried when you are in your 20s, because you started your period early. It's very normal that your period has decided to take a break. which is very questionable now. That is why we have got a lot of cases that are diagnosed at that is better, that are diagnosed at a later stage. So I didn't get to worry until now. I was in my 20s now, and I am now experiencing the on and offs, but in the middle of that there is breakthrough bleeding, whereby one continues to bleed and won't stop. That is when I was now referred to a gynecologist, and immediately I walked in. She's like, no, before I do anything, you've got polycystic ovarian syndrome. I know. So now painful periods, heavy bleeding, and sometimes I go for months still bleeding, and then the excessive weight gain, the facial hair, everything. And now I'm also experiencing pain every day of my life. That is one thing about me. So now the pain is persistent, and it is every day of my life. So personally, for me, for those who don't know me, I experience pain during my period, after my period, during ovulation, and before ovulation. So basically, because it's a week. So basically, I endure pain every day of my life. To those of you who don't know me personally. So now the pain kept increasing, and coupled with excessive bleeding, that's when I got my first diagnosis of polycystic ovarian syndrome. And I was so happy that I got the diagnosis, but that was cut short because polycystic ovarian syndrome doesn't have a cure. However, you can manage it. So let's talk about the signs and symptoms of polycystic ovarian syndrome. We talked about irregular menses. So a normal cycle is either 21, 25, or 28 days. But my cycle is 35, 42, which is very difficult to work around, and it also is very difficult to track ovulation if you have got a cycle like that. So irregular menses, that is number one sign of hormonal imbalance that causes PCOS. And then we talk about poly means a lot. So polycystic ovarian syndrome means that we've got a lot of cysts. So now the difference is that the cysts are in your are on your ovaries. So you've got a normal ovary that is plain, and then you've got an enlarged. So now you have an enlarged ovary that has got tiny follicles or sacs all around. That is what is meant by polycystic ovarian syndrome. So multiple follicles in the ovaries. This needs a diagnosis, an imaging, or a scan so that they can see. You cannot say maybe I have multiple follicles on my ovaries. No, you need a GP. Hence I say you need a gynae. Hence I said when I started this video that please have to forgive me. I'm just putting information out there for the purposes of awareness and just helping women out there. So the other one, facial hair. This one, I've seen that a lot of people like it. Hey, she's hairy, especially the other gender. There's nothing cute about that. In as much as you feel that it is cute, there is nothing cute about facial hair, because that is one sign that you might have polycystic ovarian syndrome, because beard is mainly produced by male hormones. So definitely it means that there is excessive male hormones in your body, definitely. So facial hair, and then we go to elevated androgens. Androgens are hormones that bring about puberty. So remember when we started I said I started my period early. So you see where it's taking us back. Androgens, hormones that bring about puberty. So it's either if they are high, you have so we said androgens are hormones that bring about puberty. So it means if they are high, that's when you get to start your period very, very early. And then I also watched somewhere where someone was saying they actually started the period very, very late. So in this regards, I will assume that in their case, maybe the androgens were few, like the androgens hormones weren't elevated. They were actually under or below average. That's what I would like to think. Then we've got insulin resistance. Cells in your liver do not respond well and can't easily take up glucose from your body. So now insulin resistant and excessive weight gain, they actually play together. They actually interlink. So that's why you see when we say insulin resistant, that's why you see most of PCOS patients are put on metformin, which is also medication that is put on people that are experiencing diabetes as well. And then we've got high cholesterol. So when your cholesterol is high, that is, I think basically that is above 6.2 or 6, I'm not sure, then that's another sign as well that you have got polycystic ovarian syndrome. So one thing that is important when you have PCOS, or before they diagnose you and you want to get a diagnosis of what is going on. So that's we talked about the relationship between unexplained weight and insulin resistant, and with regards to unexplained weight, in PCOS the body cells become less responsive to insulin, leading to a risk of insulin resistant. But also the catchy thing on this one is that it is very difficult. What they don't tell you is that it is very difficult to lose weight when you have PCOS. I know gynaes and doctors like to say, go and lose 5% of your body weight. You can only keep fit. You can be healthy and fit, but to lose that weight, which weight? PCOS will show you who's the boss. So another sign is acne and oily skin. Thank God that I had so many signs and symptoms and God decided that he will forgive me on acne. I have never suffered from acne. My skin is not prone to acne. But oily skin, I do have oily skin, especially on my T-zone. And the other one is mood swings. Damn, this is very, very, very common to women experiencing PCOS and other women who are experiencing menstrual health disorders as well. So depression, mood swings, anxiety, palpitations are common in PCOS. These are mainly caused by so I think they said a decrease in serotonin. So that is basically the signs and symptoms that were identified when I got a diagnosis. But remember, menstrual health issues, symptoms vary from one person to the other, and sometimes doctors don't pick up the diagnosis because the last patient had excessive bleeding, had pain, but didn't but there comes someone who is not having the period at all, or maybe the period is only for one day. That is also a hormonal imbalance. So doctors are quick to disregard most of these signs and symptoms And one thing that I want to mention as well, in regards to menstrual health disorders, is let's stop normalizing period pain. Period pain is normal and is not normal. Period pain that is causing you to miss work, to miss school, period pain that is causing you to cry, you can't stand up, it is not normal. Please, when someone comes to you and says I'm in pain, ladies, gentlemen, community pastors, whoever, please remember that it is not normal, because people like to put the phrase that, but you're being too much because every woman goes through this. No, every woman goes through period, but the cases are different. So I'll just go over the PCOS treatments that I've been given. Remember, we said there is no treatment that can cure PCOS, but then you can manage PCOS. So we've got metformin, we've got omega-3, we've got zinc, family planning, diet change, and exercising. So on top of that, I have got this holy grail that I use. So this is a Pcos. It has got inositol, which is mainly given to people that are suffering from PCOS. So this sachet contains my myo-inositol, dicro-inositol, enzymes, magnesium, vitamin B, chromium, zinc, calcium, vitamin D, vitamin K. So this helps focus. This helps in managing the symptoms and carb hunger. So when you open the box, it comes in a small sachet like this. Then you put it in your water and then you drink. This has been my saving grace. I was put on these by my doctor. I go for my yearly examinations, and he put me on this, and my brother-in-law and my sister got me these. It's almost finishing. I think this is the last box, but yeah, this. And on top of that, I always make sure that I have got Gen pain, heat patches. I've got Norflex. I was plugged on Norflex by my boss, actually, when I told him, it's like, mine, I get better when I combine Norflex and Gen pain. So I do that as well. I carry heat patches, and then sometimes I just try. One of the things that also I've seen that is coming up now is insomnia, and I've been trying to do yoga, exercise before I go to bed. Okay, so yeah, so one of the things that I'm having problems with is insomnia. So I've been taking chamomile, I've been trying to listening to calming sounds, but yeah. Thank you so much, guys, for joining. I don't know what the next episode will be, but please comment, like, and share. I think in regards to menstrual health disorders, the next episode will be between endometriosis, which is another diagnosis of mine, or adenomyosis. So I will see, and also I think we will record something to do with ADHD. So thank you so much, guys. Comment, like, share, subscribe, and share to your friends so that they can come and join the Warriors family. I call this channel a channel of warriors because, be it a parent with child with disabilities, or it's just a fellow woman facing different menstrual health disorders, we've seen a lot, I've been through a lot, and we have successfully become warriors. So until next time, thank you so much for joining. Bye.